Good afternoon and welcome to another Capital Live event brought to you by Spotlight PA. I'm Christopher Baxter, Executive Director and Editor-in-Chief of Spotlight PA. For those of you who are new to our work or programming, Spotlight PA is an independent, nonpartisan newsroom producing investigative and accountability journalism about the Pennsylvania state capitol and urgent statewide issues. We share all of our journalism at no cost with now 75 community newsroom partners across the state, all part of our mission to better inform and empower Pennsylvanians everywhere. Our work is driven by a deep sense of public service, and it's powered by you, our readers and our members. Simply put, without your support, Spotlight PA would cease to exist. And throughout this pandemic, we've played a vital role connecting you directly with the experts, doctors, epidemiologists, and others who can answer your questions with facts and authority, cutting through the nonsense to get to the truth. That's what we aim to do with our coverage every single day. I wish there was no longer a need for us to get together and talk about COVID-19. I think we're all in that boat. But alas, with the Delta variant surging, changing guidance about gatherings, return to office, return to school, and a lot more, we wanted to take some time and offer another forum in our continuing series of COVID-19 events to answer your questions and to allow you to hear from the experts about what's happening right now. So thank you so much for joining us. We provide these vital public service events on the honor system. We're able to keep attendance free for all by asking those who are able to make a contribution of any amount and become a member of Spotlight PA. So I'm asking everyone who is here today and who is able to please take a moment right now and pay what you can for this event by visiting spotlightpa.org/donate. Again, the address is spotlightpa.org/donate. This is entirely an honor system, but we do rely on your support to bring you this programming and again, to keep it free for everyone, regardless of their financial resources. Again, the address is spotlightpa.org/donate. Thanks so much. A few last housekeeping items. Thank you to all who have sent questions in advance. We will try to get to as many of those as possible. If you have not yet asked a question or just something occurs to you while we're going through the event today, you can use the Q&A feature here in Zoom. To do that, simply click the Q&A icon in the bottom toolbar and type in your question, and we will moderate those in the back end and get to as many as possible. Now, I'm excited to introduce Spotlight PA's health reporter, Jamie Martinez, who will be moderating this afternoon and who will introduce our esteemed panel of experts. Jamie, over to you.
Hi, everyone. Thanks for joining us today. Like Chris mentioned, I'm Jamie Martinez. I'm a reporter with Spotlight PA covering health, and for the past few months, focusing on the coronavirus pandemic. I'll drop my email in the chat box in a little while, but if you ever want to reach out, please feel free to contact me directly. I'm happy to talk and always welcome story ideas and tips. So for today's panel, we have 4 experts joining us. First, we have State Senator Art Haywood. He represents Montgomery and Philadelphia counties, and he's joining us also in his capacity as a member of Governor Tom Wolf's vaccine task force. They've been helping to advise the vaccine rollout over the past few months, so he's going to share what he's observed with us and hopefully give us an idea of what's to come from the state in coming months. We also have Dr. Jerome Gloucester, Chief Executive Officer and Chief Medical Officer at Primary Care Health Services. They're a Pittsburgh-based network of health clinics focused on reaching underserved people. He's also a member of the Black Equity Coalition, a network of leaders in the medical field and professionals throughout the greater Pittsburgh region that formed in part over the past few months to ensure that Black and Brown communities had access to resources during the pandemic. And he's also a pediatrician with more than 25 years of experience. We also have Fred Jackson. He's Executive Director of Wayne Memorial Community Health Centers, and he's joining us from the northeastern part of the state, hopefully to provide some insight what he's seeing on the ground and from some of our more rural communities. And then finally, we have Chris Johnson, Assistant Professor of Epidemiology and Biostatistics at Temple University. She has her PhD in public health and is an expert in studying health disparities and other mitigation efforts and interventions. So thank you all for joining us, taking time out of your day. We really appreciate your insight. So to kick things off, I'm hoping our experts can help us set the stage, give us a sense of where we're at in the pandemic and how it's different from what we've seen in recent months and over the past year and a half. So I'm going to direct this question to you, Dr. Gloucester, but Fred and Chris, if you want to jump in as well, definitely appreciate it. Can you tell us a little bit about who is getting sick right now? Who is coming through the door at doctors' offices, hospitals, and maybe how are those demographics or how is that breakdown different from what we might have seen in recent months or over the past year?
Well, first of all, thank you, Jamie, and everyone for the opportunity to join you today. I would say that what you're hearing in the news is pretty much the case, that these are younger individuals. So those in the, say, 20s, 30s, and 40s range that are getting sick right now, many of which were not vaccinated during the earlier part of the year when vaccines became available. And of course, we concentrated initially on the elderly and those most vulnerable at the beginning. But once it rolled out to the lower age ranges, 18 and above, there was a lot of complacency and a lot of resistance to the vaccine. And those are the individuals that are getting, the most sick and ill right now. That's my perspective. I would welcome, Dr. Johnson or Fred to jump in as well.
I think that pretty much.
Go ahead, take it away. Yeah.
I think that pretty much sums it up. There is some breakthrough infection, but they tend to be mild. The ones that are very sick are the unvaccinated, and it's the hesitancy is a tough thing to break.
And it's worth noting, Pennsylvania is seeing an increase in cases. We've been seeing cases go up since early July after a lull in the spring and early summer months. About 65% of the population 18 and older is fully vaccinated. So we are in better shape than some other states, particularly those in the South. Is that a good assessment?
I can jump in here. So I would say that we are in better shape overall, but the unique qualities about the Delta variant, which has become the overwhelming majority of cases in the United States now, are that it's more infectious and it can have more severe consequences. So the fact that it's more infectious should make us feel a little less secure in that 65% number, but also thinking about just the number of children that we have in the state and people who are 0 to 15 years old. And none of those folks are vaccinated unless they're part of a trial. So while 65% of adults is an excellent number and we should keep striving to increase that, we're really not going to get anywhere near herd immunity and feeling fully protected and going back to a true sense of normal until we also are able to get those children vaccinated once the data are available for that.
And Dr. Johnson, just to stay on that for a second, can you explain what you mean by more infectious when we're talking about the Delta variant? What does that mean?
Right. So the CDC has a nice page that lays out how each of the variants differs from the original strain of COVID-19. And so the Delta variant is more easily transmissible from an infected person, an infectious person, to people who are susceptible. Obviously, we know that if you're vaccinated, you have a good amount of protection against those infectious particles, but the Delta variant itself is 2 to 3 times as infectious as the original strain of COVID-19 that we had been dealing with. So those are things that we can actually anticipate seeing with other variants going forward. And that's why it's so important to get people vaccinated as quickly as possible to eliminate the virus's possibility of creating more variants that continue to be more infectious and more virulent or deadly.
We got several questions about what we know about the number of Delta variant cases or the number of breakthrough cases. Do we have good data on that right now in Pennsylvania?
I might defer that to other folks. Other than with breakthrough cases, I would say that we don't have a good amount of data on the breakthrough cases, particularly at the state level. And I think that's just a manifestation of how hard it is to collect good data with so many cases going on. Now, with keeping up with the number of cases that are attributable to Delta, that's something that's a function of how many cases are actually sequenced. And that can depend more on the clinician. So that's something that I would defer to our clinical panelists here.
Dr. Glasser, I saw you on mute. Do you want to jump in there?
Yeah, sure. I was going to say that my perspective and also within the Black Equity Coalition, we have data analysts and epidemiologists as well looking at what's happening locally. And I actually totally agree with Dr. Johnson in that there's not good data. We have a monthly meeting actually with our director of the county health department here in Allegheny County. And we discussed this as well with her, Dr. Deborah Bogan, and it was a similar response that you're getting some testing down to this strain with positives, but you have people coming in all the time or going to a CVS or going to a doctor's office and they get a COVID test and they're positive and they go home and quarantine and we're not testing to find out whether that was Delta or not. Having said that, Dr. Bogan said something that for me made a lot of sense based on what we're hearing. She said, we should just assume that most of these are Delta variant. When we've been told for the past, say 60 days that that's mostly what's, rising in our country right now. We should just assume that. So we're guessing that most of these are Delta, but the data, we don't have good data.
Right.
We had,
Brett,
go ahead.
I can't attest to the source, but because we have data coming at us from a lot of places, but I've heard the number 94%. Whether that's accurate or not, who knows?
So we don't have a
In
hard,
line with what I've heard as well.
okay, so it somewhere in that 94% area, we know most of them at this point are likely Delta, it sounds like. We had a reader question come in from Dr. Herder. They ask, what is the threat of Delta to those who are vaccinated and who had COVID in the past? I guess to put that another way, how worried should people be personally about contracting the Delta variant, and how different could it be for them?
From my perspective, I actually have gone back to acting like I don't have the vaccine at all to make sure that I am at a heightened awareness to ensure that my family doesn't get the Delta variant. Part of that is because I am pregnant. I'm fully vaccinated and was during pregnancy, but we don't know how much worse Delta variant can be for pregnant people either. But I would suggest and have suggested to my extended family to just kind of pretend that you don't have any protection from that vaccine. That's not true. You have plenty of protection around it. It does prevent severe illness, hospitalization, and death at excellent levels. But if what you're concerned about is actually becoming infected, then I would say go back to what your most heightened level of prevention and mitigation measures was throughout the pandemic.
Yeah, I echo that. I think that what we know is that the current vaccines provide a great amount of protection even against Delta, and that's why the majority of cases of those who are getting ill are unvaccinated individuals. And so that's the good news. But as Dr. Johnson has said, I really advise people to look at this as, if you will, levels of protection, or one analogy I gave in a discussion with a community group last week around resistance and what have you. I gave the analogy of riding in a car, and you have your seatbelt, you have your airbags, and so basically the more stuff you have, there's more protection from you getting killed in an accident. It's not that it can't happen, but you know what, when you pile on more and more protection, you're really decreasing your risk. And so likewise, the fact that those of us who are fully vaccinated, the fact that we have a lot of protection, I think that should help us not to have a lot of anxiety, but at the same time, like Dr. Johnson has said, I recommend you wear your mask, distance, act like, before we even had the vaccine. That way you're really giving yourself the most protection. And also not so much, like we said, that those of us that are fully vaccinated, we may not get seriously ill, but we could spread it to someone else and they could get seriously ill.
Senator Haywood, the state has put a lot of emphasis on getting vaccines into arms. We've had media pushes, we've seen text message campaigns, we've heard a lot about outreach at the local level. Can you talk a little bit about what the vaccine task force has been looking at over the past few months in terms of reaching people who are unvaccinated, and how is that going?
Yeah, thank you again for inviting me on and having this conversation. So the Vaccine Task Force has been meeting, and our core efforts has been to encourage local organizations on the ground to get the message out. Most recently, the Department of Health has provided some support to social media influencers, getting young people who are social media influencers to push the message out. This is happening in Pennsylvania and Colorado and some other states as well. So the education component is really the main avenue that we're using, as well as funding some organizations like Latino Connection, actually the coalition, the Black Equity Coalition, and many others across the state. I did want to mention something briefly with respect to the breakthrough data and the lack of data that was mentioned previously. Department of Health in Pennsylvania has been defunded for many years, and therefore is only now using national money, federal money, to ramp up data management and laboratory capacity, which is both are in dire need. And if Pennsylvania can build up laboratory capacity, we'll be in a much better position to determine what's the strains and detect the strains and share with the folks across the state, clinicians, what the strains are and are not. And if we can get the data management system up to a 21st century level, we'll also be able to share important information. These are two important areas where I think we really need to build public health in Pennsylvania.
You mentioned there's outreach at the local level. Who are we still trying to reach? Who, from your perspective, still needs to hear these messages? And what is the state working on to make sure, we just had a reader question from Claire G come in. She wants to know how the state's rollout of boosters will be handled. Can you talk about some of the things you're working on looking forward?
Sure. So with respect to boosters, the Vaccine Task Force is scheduling a meeting to talk about boosters and how that may be managed. So I don't have a decision on that yet, although it's definitely part of the conversation. Also part of the conversation is we do anticipate that those under 12 that will get approval for vaccination, that we will get vaccination approval for 5 to 12. So we're having conversations about how to prepare for young people to be vaccinated. So these are key conversations that are currently underway.
While we're on the topic of children under 12 getting vaccinated, and I think this is related to boosters as well. Do we have enough information at this point to talk about a timeline for that rollout? This might also be a question for the clinicians in the group. What do we know about what's coming for vaccines for kids under 12 and boosters? Let's take kids under 12 first. What might that look like?
What we've heard is that the emergency approval for children under 12 is likely to come in the late fall or early winter. So we are hoping that we will get that emergency approval before the end of this year. So that's the timeline we have heard at the Vaccine Task Force and are looking to prepare for.
And what about boosters? Where I know that it's coming in on different timelines for Pfizer, Johnson & Johnson, Moderna. We got some news, I believe, about Johnson & Johnson today. What do we know about those boosters?
So I don't have, we haven't really discussed Johnson & Johnson. It looks like the task force and the state will be supporting boosters. And it looks like the current framework is 8 months after the second dose, 8 months after full vaccination. The program for that has not rolled out at this time. And so I don't want to put people in a set of expectations that are not reliable. And so I would want to share that with anyone who's listening. The booster rollout is still under consideration. And we had a lot of challenges with expectations back in the spring. So I don't want people to expect that they can get a booster in the next week or day. That process is still under development.
And anything to add from a provider perspective, Fred or Dr. Gloucester?
Yeah, I think that, you know, if they stick with the 8 months, I think at that point, the rollout and the restrictions of inventory that we had back in January will control the flow of rollout going forward. And it allows us to do things in a much more orderly fashion. And not that anybody liked being short on inventory, but it does set the stage for going forward in a positive manner. And that our challenge right now is the pro-vaxxers that are on our phones, lighting up our phones. They want it now. I said, well, right now we're just in the immunocompromised. Hold your horses, and they are being good about it for the most part, from what we're seeing.
I agree. I think Fred makes an excellent point that, previously with the initial rollout, all of our systems were completely overwhelmed with demand just tremendously exceeding supply that was getting to us, the vaccine distributors. And we're in a much better place right now. And we also have sort of a natural schedule that can occur based on that 8-month window. And so I think that's an excellent point. I think from a clinical perspective, I likewise agree with the senator. Wouldn't want to give people any kind of false hopes as far as scheduling. But I would think from a clinical perspective that given the fact that we're going into the flu season, we're going into the months of really increased clinical disease, that I think there's going to be a heightened sense of urgency to move things along. That's my guess. That's my perspective, and so that those recommendations should be forthcoming. Having said that, like I said, I'll keep going back to what the senator said. I wouldn't want to just try to give some sort of guess as far as when that's going to happen.
We got a reader question from Jean K. Speaking of the flu and flu season, wanting to know if flu shots and boosters are going to be compatible or safe. Any concerns about if you go in for your flu shot in October, November, that happens to be the same time you're due for your booster? Anything to worry about there?
No, at least everything that I've heard and read, the CDC is saying there's no concerns around the flu vaccine and the COVID vaccine being co-administered. Initially, the recommendation was to wait at least 14 days between COVID vaccine and other vaccines. And now, based on the evidence and the data, they're saying that there's no contraindication to them being co-administered.
We've been talking a lot about vaccines, but of course, there are other things you can do if you're trying to mitigate the spread of COVID-19. One of them being masks. And it's been a big topic. Everybody wants to know if universal masking is likely to come back. That order statewide was lifted in late June by the Pennsylvania Health Department. So far, the administration has said repeatedly, at least to us in the media, that universal masking is not likely to be considered right now or to come back. Senator Haywood, is there, do you have anything to weigh in here? Is there anything that the General Assembly could act on or is thinking about in terms of masks and masking?
So the General Assembly has two pieces of legislation that have been proposed. One is to allow parents to opt out of masking. And the other is to make parents liable in the event that a student who is unmasked allows other people to contract the virus. So those are two kind of opposing views about what should happen. I don't think that either one of those are likely to make it through the legislature as currently composed. I do think, though, that the question of masking in schools, which is a much narrower set than the entire population, will come back for discussion, particularly those who are in elementary school who obviously cannot be vaccinated. So I think that population in particular may be the subject of some kind of masking approach. Previously, the governor said let every school district make their own decision. Of course, there's 501 school districts. From what I've read in the newspapers, there's a lot of conflict and tension at some of these school meetings. I think at least one or two may have erupted into some level of violence. And so there may be a need to reconsider this school masking approach, because certainly there's a high value to masking. I think the clinicians have already stated that. So I do think a second look at school masking may be required here.
And yes, just to backtrack on that a little, if you are vaccinated and you are wearing a mask, who does that protect? And why might it be a good idea? Dr. Glosser, is that something you can weigh in on?
Sure thing. I think that the good news is that back to those layers of protection, the vaccine is giving you the most amount of protection against disease. Having said that, we found that masking protects, initially we looked at it as protecting the person that was unmasked. Someone else coming near you, as long as I have it on a mask, at least you're not going to get it from me. But the evidence has shown that there's some protection both ways, so that by me wearing a mask, I'm protecting myself somewhat, even if it's just a basic mask, 3 layers of fabric or what have you. I'm protecting myself somewhat against someone else that has COVID. So back to these levels of protection, and as the senator has mentioned, when we look at universal masking, if you have everyone masked when they are in a certain area, and then they're also trying to stay distanced as well, I think we extremely limit our risk of exposure and really heighten our protection against disease.
Early in the pandemic, there was a scramble for PPE in workplaces and just people trying to go about their lives. Do we need to have an N95 mask right now? Is a cloth mask sufficient? What should people be looking for, trying to buy? What is the best option right now?
I don't know if Dr. Johnson wants to weigh in, if she has anything to.
Yeah, I'm happy to weigh in here. I would say err on the side of the most rigorous mask that you can have. I actually am a double masker. I usually use KN95s, leaving N95s for people who are in those higher risk situations, like our healthcare providers, because I don't want to be part of that run on those supplies if that becomes an issue again. So I typically do a KN95 that fits my face very well, one that has a metal piece to kind of seal everything out. And then I put a cloth mask over it just to make sure that that seal sticks. So I think what's most important is that you have a good quality mask that fits your face well, which can be harder for people who have smaller faces and for younger folks like our children. But that would be my recommendation. So I just saw somebody said, what's the difference between an N95 and a KN95? I'm not familiar with the exact physics of what's different between them, but KN95s do provide you with a lot more protection than just a cloth mask alone. And then, so I use a cloth mask more as like an additional barrier to make sure that my KN95 is on securely, so that I'm getting all of the protection that KN95 does offer.
Yeah, I completely agree. And the N95 has the highest level of protection. KN95 is rated lower. I don't know the physics either, but I know that it's not rated as high as an N95. And I think that the biggest thing that Dr. Johnson points out is that these types of masks, they fit snugly and don't allow for air pockets and entry points, if you will, for the virus. But as I was stating, I think that the good news is that some basic masking does provide you with some protection. And I know there's different studies. Some say maybe it's only 30% protection, like you're saying, but that's something. And then if you have, everyone, back to my point, everyone masked and distanced, that's providing a ton of protection. And then, as she stated, then if you're able to get the highest level of protection, then your risk is almost zero at that point. I think the biggest concern that she also brings up, excellent point, around us sitting here and say everyone should run out and get an N95, then there's not enough for those who need it the most and who are most at risk. But that this is what the data shows as far as the protection that you can achieve with these different types of masks.
We're getting a lot of questions about what you can and can't do as a vaccinated or unvaccinated person. Any recommendations? We've got a bit of a list accumulating here, but related to large outdoor gatherings, eating in a restaurant, singing in church or in a congregation choir. How might people navigate some of these situations? Any advice on maybe a checklist to consider, or how do you evaluate your risk in these different types of situations? How would you respond?
I can jump in here. I would say that if you are not sure about people's vaccination status at any event, that should immediately be kind of a red flag for you to consider whether it's worth you going to that event, whether it's outdoors or not. Because if you're outdoors and you're still going to be kind of squished together and not have that social distancing, then you can still be in people's kind of in their cloud of particles. If everybody at the outdoor event has to be masked, that might change it a little bit, because then you have that more protection that Dr. Gloucester just spoke about in those layers of protection. When it comes to anything indoors, I would be a lot more conscientious about the requirements of that. I myself haven't even gone into a grocery store in the last week, just because in the location where I live, we don't have to wear masks. And that made me feel very uncomfortable, again, as a pregnant person. And with the Delta variant going around, that's something that is a high concern for me. So if masks aren't required and it's indoors, or you're dining indoors, so people are, by function of being there, going to not have their mask on for an extended period of time, and then you should probably reconsider. I would stick with outdoor dining personally until we have this current surge in check. And I can't even give an idea of when that's going to be. since things are still worsening throughout the South and throughout the country as well. So the checklist would be, are people wearing masks? Do I know that everyone there is vaccinated, like in the case of some music festivals that we've seen, and or that we've seen, or that people have had to provide a negative PCR test, a COVID test in the last 48 hours before attending that event. So there are events, concerts, large social gatherings that have required that. And that can give people enough peace of mind, especially if they know they're fully vaccinated. But again, I'm still operating at the highest level of multiple preventive measures. I'm happy to hear what Dr. Gloss or Mr. Jackson have to say as well, or Senator Hayward.
I think with anything, we have to, assess our own risk tolerance in these things as we, is a point we have to, we're trying to somehow normalize the pandemic because it's not going away, and I don't think it is going away. And so how do we learn to live with it within, the risk level we all want to take individually? I mean, I'm okay with a grocery store, but I don't want to get on a plane, and I certainly don't want to go to a concert. So it's individual choices that we have to make.
As we get ready to head into the fall, people are going to be spending more time indoors. We have students, K-12 all the way up through college, back in school. There are concerns about a surge, and Dr. Johnson already mentioned southern states are already seeing this. Hospitals are getting overwhelmed. Is that likely to happen here? And Fred, why don't we start with you? Do you have any concerns about in rural areas, healthcare providers getting overwhelmed or seeing the level of hospitalizations or visits that we saw last year?
I think in general, we're better overall than the southern states and Texas, Florida, that are really challenged right now. Even though the rural counties there is some quite low rates, we're a little better in Wayne and Pike County than the state averages for rural counties. What we've heard in some thoughts is that as it progresses, it'll make its way further north. I don't think we're going to get hit as hard, and maybe that's just a Pollyanna view, but I think that we've done a better job, and hopefully just won't be as severe. I don't have any empirical knowledge for that opinion. It might be just a hope as much as anything.
Sure. I mean, none of us have a crystal ball, so it's hard to predict the future here. But how is Wayne Memorial preparing? Is there anything you're doing differently, or anything that you learned from last year that you're going to be considering in the coming months?
Well, we're preparing for the booster, and what we would like to do is, in the hesitancy, we feel it's up to our doctors and our clinicians with one-on-one with those that are hesitant, and that's how you move them over. So we're trying to move away from mass clinics to direct distribution in individual offices. Our challenge being is that we have a lot of small offices, and with the vaccine limited to 10 and 14 dose vials, you still have to get some grouping to avoid a lot of wastage. And really, I think the distribution has to get down to smaller lots. So when you have that patient in your exam room and you convince them, you get it then when it's convenient, not on their terms, not because a lot of the non-vaxxers that are on the fence, the heavy duty non-vaxxers you're not going to get, but those that are on the fence, and a lot of the young people, it's a convenience issue. And if we get it more convenient, then we might get there.
Yeah, I just want to clarify something you said. It might answer some questions that I've received from people. The vaccines still come in fairly large quantities. They're packaged in bigger boxes that your local physician's office might not be able to store, or once those packages are opened, be able to go through all of the vaccines quickly enough before they expire or they have to be disposed of. Wayne Memorial has been doing vaccines at the county fair. That was something that wrapped up a couple of weeks ago. And Fred, correct me if I'm wrong, about 100 or over 100 vaccines were administered during that.
Yeah, I got a comment that I'm going to defer to the center. The challenge with the fair is, we had 3 staff people over 9 days, 63 hours times 3 to do 150 vaccines. That's not a tolerable efficiency. And so if we can get it down into the routine course of what happens in the health centers between the doctor and the patient, that's what we have to try to get to. And
Senator Haywood, is there anything to add to that?
Thank you so much.
Yeah.
Yeah, I just want to respond to the comparison to Florida and Texas and Georgia. Right now, we have 80% of those who are 18 and older have had a first dose. They're not fully vaccinated, but we have a vaccine ratio much higher than any of those states. And I really caution people. I know they're watching the news. They see the trouble that's in Florida and Texas, and they think it's in Pennsylvania. First of all, it is not in Pennsylvania currently. And our vaccine rate that we have, I think, makes it less likely that we will see what is being seen in Florida and in Texas. And those are all states that had a somewhat hands-off approach from the state government to vaccination and masking. We have not had that approach here in Pennsylvania. So I caution people when they see the news, it's really not what's happening in Pennsylvania currently. And we have the power to make sure it doesn't happen in Pennsylvania by getting vaccinated, by wearing masks. These are matters well under the control of everyday citizens. So this is not a place where we have to throw up our hands. Getting vaccinated is a way out of this. Wearing masks is a way out of this. Each of us as citizens have a way out of this.
And I would agree with that, especially because in those states that you mentioned, Senator Haywood, that those are states that have also had policies that specifically outlawed or kind of put a stigma around wearing masks and did not allow mask mandates to go into place. And that's not what we're seeing in Pennsylvania now. As numbers are ticking up, we're seeing school districts and individual employers put those mask mandates back into place, and different municipalities do the same. So we're not seeing that same resistance to those layered mitigation measures in Pennsylvania. So hopefully that will also be something that will help us prevent that overwhelming of the healthcare system. Not that it can do it by itself, but again, as Dr. Gloucester said, as Senator Haywood said, this layering of mitigation measures to prevent what we're seeing going on in those southern states.
And Senator, just to backtrack again on boosters, we're getting some reader questions and some listener questions. When will the state have a plan on boosters, and when can we expect some of those details? You mentioned a timeline earlier, but I just want to make sure we revisit it since we are getting questions about it.
Yeah, no, certainly. I would anticipate now, first of all, I do want to be clear. I do not speak for the governor or the Department of Health. So I do want to create that clarity. But I would anticipate further discussion and a plan for boosters early September, even though I know early September is only about a week and a half away. But I would anticipate early September.
Early September for plan and discussion, more details coming later.
That's what I would anticipate. Now, sometimes the details come at the same time because decisions can be made relatively quickly on this matter. I can tell you that the Department of Health in the Commonwealth is already preparing a plan, just has not been released. So I don't want to give people the impression that discussion and planning is not underway, but the release of it and final approval is still in process.
Dr. Gloucester, what are you most concerned about heading into the fall?
Well, I think I'm probably in the same boat as everyone on this panel, in that the the amount of resistance to mitigation measures that are occurring, and it's at the level of those who are vulnerable, those young people right now. I would say that's one of the things. Maybe it's because I'm a pediatrician, I don't know, but I doubt it. I think we should sort of share that. When I see, these discussions erupting into violent altercations of, our families and our parents, with a resistance to protection, that's probably the most concerning thing for me, because as Senator Haywood has said, and others, we have all these protective measures in front of us that if we follow them, we can extremely limit this virus's ability to cause disease and death. And when there's a lot of fighting against doing that concerns me quite a bit. But from a clinical standpoint, I would say that I'm thankful that I think we learned a lot from last year. I think that we are in a better position than we were, when we didn't have vaccines, and even once vaccines came out and we were overwhelmed. I think we're in a much better position from that standpoint for those that are, want to get a vaccine, and those that want to follow the guidelines. There's a lot of protection and a lot of likelihood that we will prevent a lot of disease and death. So that's what I'm thankful for. But even the things that we've done, we found last year where there was almost no flu. Guess what? Because we were doing viral mitigation protection, and that helped, prevent, the dreaded double whammy of flu and COVID. So I think that those lessons learned will really help us moving into the fall. But hopefully, we start to see some resolve with all the fighting and us coming together. And I think that, I hate to say it, but I think it might need to come from, the government, like it did before, because I think individual school districts, they can't handle this. These school boards, I feel like they feel they're overwhelmed as well. So you have, these individuals on these school boards trying to do what they think is right, and then they're facing death threats and everything else. It's just really a sad situation right now in that regard.
Yeah, I would agree with that. We consult with our local school districts, and the superintendents are in a really challenging position with the communities, and there's data that says you're not going to make anybody happy. Mandate gets the non-vaxxers upset. Non-mandating gets those that are for the vaccine upset. So you're not going to win either way. But trying to get some help to the local school boards, I think in directions from the state, I think would be a big help.
And I would echo that, because Philadelphia Department of Public Health really gave universities and schools within the Philadelphia district that kind of cover to go ahead and mandate vaccines and mask mandates indoors, whereas before they were kind of teetering because you can't make everybody happy. And so that kind of cover that allows schools to follow what they feel is the best course for the health and well-being for faculty, staff, and students is really important, because otherwise you are dealing with this county by county issue. Now, that said, I do understand that people are concerned about these mandates and requirements if there is not that much transmission. So that's why I personally have been pushing for looking at the county by county transmission rates for CDC. Now, the vast majority of every county in the United States, the vast majority of them have substantial and high transmission. But if we can tie mask mandates to that, then at least it's a metric that people can look at and say, okay, well, that makes sense. We have to have masks because we've seen a surge in cases and transmission. And that way it kind of plays a little bit to both sides. But that, I think it is important to have that cover from a governmental institution for employers, school districts, et cetera.
We have about 6 minutes left, and one reader question that came in from Scott G asking any concerns right now about other variants like Lambda or others might emerge. I think that's a good forward-looking question maybe to start wrapping up on. Would anyone want to weigh in on how the new variants are being monitored and how worried should we be?
So CDC and other, like the World Health Organization, they have been monitoring these variants as they come out. And part of the reason that now we say alpha, beta, delta, et cetera, is to make sure that we're not stigmatizing where those variants originated from. But whenever we see the amount of transmission that we're seeing in Texas, Georgia, Florida, it's very likely that variants can intersect with one another and create another variant. So one of the most important things about wearing masks and making sure that as many people are vaccinated as are eligible is to make sure that we shut down the virus's possibility of creating new variants or combining variants. So it is something that we are concerned about, especially when we see the amount of transmission that's going on, but it is something that is also being pretty closely monitored by CDC and other international and governmental and non-governmental organizations.
Anyone else weigh in on that? Okay, we have about 5 minutes left. I want to make sure, thank our panelists for being with us today. Is there anything you want to make sure you leave our readers or our listeners with? Any final takeaways, anything you want to point out that I didn't ask about that you think is really important for people to know?
I would like to just briefly say that this response to the pandemic is widely under our control. Vaccines are readily available. Folks should get vaccinated. That's part of the solution. Masks are generally extremely affordable. Masking is also part of the solution. So I understand the importance of looking to government to provide cover as what was described, but each of us have the power to address this virus with a cousin or aunt or a relative. So I do believe this is an important opportunity for us to step up as citizens and take responsibility for our communities and protect the lives that will be lost otherwise.
Anyone else, any final thoughts?
I would echo that from Senator Haywood, that we all need to do our part. And part of that is making sure that if we're vaccinated, that we're talking to the people who are in our circle of friends, neighbors, and advocating for other people to get vaccinated. As a pregnant person, I am acutely aware of the number of people who are pregnant who are not taking the vaccine because they're concerned about how it could affect themselves or the baby. But because of that, we're also seeing a very high number of women who are delivering and then dying as a result of a COVID-19 infection, particularly in those high transmission areas. So just encouraging people in your bubble to get vaccinated and doing what you can to dispel any misinformation that might be on your social media sites is something that's really helpful. And then also just pointing people to reputable resources, to .orgs and .govs instead of social media posts, to make sure that people are getting the best information out there as possible. And then making sure that we're protecting people who can't be vaccinated or who are immunocompromised. So that includes our children, making sure that everyone around our children are vaccinated and masking, and being very conscientious around that.
I think that what I would focus on as we close is again, thank you for the opportunity, and likewise for this esteemed panel. The comments I felt were excellent. I think that again, hopefully we get to a point where we're doing everything to try to come together and do the things that will protect us all. And I think that as we look to that, as Fred mentioned before, as far as us clinicians, it's really a grassroots effort. It is that those one-on-one discussions. My providers are telling me as well that you're able to help dispel myths, but at the same time meet people where they are and understand where they are with everything. And when you're able to do that, then you get people to at least consider moving, off the fence. My providers are telling me that that's happening, thankfully, every day now, that there's individuals that said never, 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 and then they've come in and said, you know what, I think I want a vaccine. But it was that patient, just working with them, if you will, to meet them where they are. But I think following the guidelines and us, really trying to come together is my hope.
Yeah, I would just echo the senator's comments and thank him for the word. It is personal responsibility. And as we move forward and somehow, if there's a way, take the politics out of it and get it back to a healthcare issue, not a political issue.
Thank you, everyone, for your time today, and to our listeners and readers who joined us. Thank you, too. I'm going to hand it back off to Chris. I will put my contact information in the chat box. Again, welcome to have any follow-up discussions with any of our listeners, answer questions, and thank you again for joining us.
Great, thank you, Jamie. Thanks to the panel. This was a great event. I'm glad we got to tons of questions in there, really kind of useful, on point, what people are thinking about right now. So thanks everyone for a great discussion. With COVID-19 remaining a part of our lives for the foreseeable future, unfortunately, we at Spotlight PA will continue to provide you with the information you need to stay smart and stay safe. And we can do that because of your support. Today's event was a free public service provided by Spotlight PA. And so I'd like to remind any of you who have not yet made a contribution and are able to do so, please go to spotlightpa.org/donate. Contributions of any amount help us keep this programming free for those who need it most, and your support goes directly back into our journalism and programming. Thank you again to everyone who has become a member today and contributed. We hope to see you at our next event. We've got a great lineup. So keep your eyes peeled for that, and otherwise have a great week.
Thank you for having us.